But we begin this hour with reports of a new version of the Omicron strain, also known as BA2, or the stealth variant. It's reportedly been identified in dozens of countries, including the U.S. Scientists say this subvariant is harder to detect. Some data suggests it could be more contagious, but there's a lot we don't know. CBS News medical contributor Dr. David Agus joins us to talk about that and also answer your questions about a range of other COVID-related concerns. Dr. David Agus, good morning. How are you doing?
I'm doing good, Nate. Nice 67 and sunny here in Los Angeles.
Okay, you don't have to rub it in, okay? All right, Doc, so what can you tell us about this new Omicron subvariant?
You know, it's called stealth, but it's really not stealth. What it means is that Omicron has two different sisters, if you will, BA1 and BA2. BA1 is the one that had been dominating the United States. And when you looked on PCR, it looked differently than Delta did. BA.2 looks exactly the same as Delta, so it's just as easy to detect. It just looks like Delta on PCR. And what we're seeing is that countries like Denmark, which are weeks ahead of the United States in dealing with Omicron as a whole, you're seeing a significant rise in BA.2. 50% more infectious, but we're looking at, with the booster, you have significant protection against BA.2, and that's what people really care about.
Dr. Agus, we have some questions from our viewers, so we want to throw some your way, and hopefully we can clear some things up for people that are at home watching. Our first viewer, Deb, she asks, the CDC now recommends N95 and KN95 masks, but they're often hard to find and expensive. Can you safely reuse these types of masks?
Yeah, early on in the pandemic, the CDC recommended against them because there weren't enough for hospital workers. Now there are. And so the thing about it is hospital workers, they have to throw them out after every patient room because you don't want to bring something from one room to another. But for the people in the community, when I go out, I wear an N95 mask, and I wear it normally for 3 or 4 days. You know, the particles over time can get clogged. The strap can get stretched out, so you don't want that to happen. So 3 or 4 days, and then probably go to a new N95 or KN95 mask.
Okay, good to know. Got a good question now from Syria. Syria, I hope I'm saying your name right. And your question is this: if you're still positive on a rapid test 10 days after the onset of your symptoms, are you still infectious?
So what the data show is that about 50% of people by day 5 are no longer infectious and about 90% by day 10. So if you're still positive, it may be what we call viral fragments, so not active virus that you're infected, but you may be in that 10%. So I would continue to wear a mask when you go out and when you're interacting with anybody if you were to continue to test positive at day 10.
Dr. Agus, Sylvia would like to know how best to protect children under 5, given that they cannot yet be vaccinated.
Well, Sylvia asks, obviously, a critical question. In Denmark now, we talked about that being kind of the lead place where we're studying BA.2, the new variant. 12% of hospitalizations in Denmark, 12% are under the age of 2. So we have to protect that part of the population. They should have a vaccine, we hope, in March, as long as the FDA accepts the 2-shot data and is not pushing for the 3-shot, and then maybe a little bit longer. But when you go out, you want to make sure that that young child can wear a mask, wears a mask if they can, and that who they interact with is really critical, is that the people they're interacting with, they have to wear a mask. And so as much as possible, protect them. There's hope around the corner. We will have that vaccine for that age group, and they will have protection hopefully soon.
A lot of people, David, are asking Carol's question, and it's this: how soon after recovery from COVID can you vaccinate or boost?
Gayle, you know, there's no real study on this, but my gut is 3 or 4 weeks. So 3 or 4 weeks after COVID infection, if you haven't got a booster, I would go and get that booster shot. Or if you haven't been vaccinated at all, I would start the 2-part series.
All right, I have a question from Alicia. She has a question about what to do after you have close exposure with someone who has COVID. And she says, she asks, we quarantined for 5 days, pretty much symptom-free, and we are unable to buy COVID tests. Are we good to go after 5 days?
Good question.
So, yeah, it is a good question. And so I would continue to wear a mask. You don't need to isolate, but I would wear a mask when you go out up till day 10, just to be safe. And I know it's really hard to get tests out there. And so everyone is saying, well, do tests and you need 2 negative tests in a row. All of that is true, but we can't get the tests. We don't have enough in this country. And so use caution and wear a mask with all interactions up until day 10.
Dr. Agus, we have a viewer named Kara who asked a question that I think is on all of our minds, and that is the question of the hour, I would say. Is there an end in sight? Say yes.
And the answer is yes. I mean, BA.2, this new variant, will slow the decline in that curve. But if you've been exposed to BA.1, the first Omicron, if you will, that you will have immunity. Hopefully that will cross over to BA.2. And since so many people have been exposed, I think we're going to see a decline. And really, you know, I had said before, I think it was mid-February when we're going to see that significant decline. It's probably going to be pushed out a week or two because of BA.2, because of this new variant that's now about 9% of cases in the United States. But we are going to be in a much better situation come spring. And so I think toward the end of February and March, we'll have significantly lower numbers of cases in this country. And then hopefully in March, we could start to vaccinate the under 5 and our shoulders come down. And so the key now is that the people who aren't vaccinated, who have yet to receive a booster, the booster is critical for this new variant, that they get those. And then we're going to be in a much better situation in this country.
Yeah, we've heard this before. I'm just glad you can use the word decline. It's such a moving target, but I like the word decline in your sentence these days. Thank you very much, David Agus. Always good to see you.